I can go. Tasha Bozak, I'm in concert, so I'm with the Neutrals Learning Community Connection Center, which is FCSS and adult learning. I'm currently the only full-time staff or FCSS director left, and we weren't able to replace her, so I'm doing both pieces, but we've hired some contract staff, which are actually helping in a big way, and then are partnering with the Family Resource Network out of Stettler to run a lot of our programs too. So that's actually been really good partnerships and has been helpful. You said what? Something we've overcome this week?
Yeah.
I guess yeah, I've just been sick most of the week, so the fact that I've been in the office 3 out of 5 days this week has been pretty good. I don't think I've taken a sick day in like years and years and years, and I was home for 2 back to back, and it drove me nuts. So I think I'm actually all caught up for missing those 2 days. So that's a good overcoming for the week to end the month.
Good job, Natasha. Next person I see on my screen. Oh yeah, go ahead.
I'm Rihanna Stockman. I'm with the Town of Beaver Lodge FCSS. I'm the only employee for FCSS, so I wear many hats here. Something they overcame this week. I know what you're talking about, the whole sickness thing. Same with me. That was me like 2 weeks ago. I took my first sick day in like 8 years for it, and yeah, it was rough. So I hope you're feeling better. But for this week, we had an open house this week on Wednesday. So I feel like I had a lot of stress leading up to that, and I got through it. So I'm happy now.
Good job, Brianna. Thank you for chiming in. I got to change my view here to see everyone. Let's go with, oh, Sandy's still connecting to audio. Steph, do you see anyone off the top of your screen?
No, it's just us. Sandy's connecting to audio.
Okay, sounds
I
good.
can go.
Yeah, you can go. Give her.
I'm Stephanie. I'm from Healthy Aging Alberta, so I support all the core groups here and anything you're up to in core. And yeah, my role is engagement and communication specialist here. I don't know if I've overcome one particular thing this week. I do know I was pretty pleased with myself yesterday when I was doing some great data collation for my 2 big reports that are happening right now. So that was pretty fun. I was pretty pleased with myself. Maybe that's an overcome. Maybe that's a win. I don't know. But yeah.
I'd say we count that as a win for sure.
Yeah. And getting a nice chunk of time yesterday to actually dive into the report uninterrupted and, power through a bunch of writing. So that was fun.
That's tough sometimes, to get the uninterrupted time.
Exactly.
I guess one thing that I overcame this week, I'm not going to lie to you guys, my stepkids are driving me nuts lately. So the thing that I've overcame this week was letting them both live another day, I guess. Completely kidding. But no, seriously, it was a very stressful week with them, and now everything seems to be a little bit more calmed down. It's like the 3rd week of school or whatever, so now they're getting more comfortable and they're not nervous to go there anymore. So now everything is just kind of exploding. But anyway, like I said, we'll talk about some respectful ways to bring up different kinds of issues with our senior population, actually. So a couple weeks ago, as some of you know, I run the transportation program that we got the grant with Healthy Aging Alberta through in town here. So I'm coordinating that program, and I do a lot of the driving and different things like that. So a couple weeks ago, I had a client, a very good client actually. I've developed a pretty good relationship with him. He did fine going to his appointment, went back to his house and missed his walker in his garage where he was sitting down. So he took a little bit of a tumble there. Previously, before that, he actually collapsed at the nurse's station in the hospital, which I was unaware of. So 2 tumbles for this guy, and he still is adamant about just using a one-handed cane and different sorts of things like that. Very stubborn, right? As I know some of you are in small towns as well. That's kind of how the population is in these small towns. They're used to doing what they've been doing for the last couple of years, and when you try and take away the freedoms, things can go downhill very quickly. Another thing with this certain gentleman, without breaking privacy stuff too much, is he got his driver's license taken away a couple months ago as well. So he's in kind of that limbo stage of people telling him what he can and cannot do, right? So my role in all of this after he takes his tumble and we get him situated again, it was just basically the struggle of how to let this gentleman know now he's not just a client because I've been dealing with him for the last year. So we kind of develop a personal relationship in that sense. So it's now I'm in the spot of trying to bring up to this gentleman now, like, all right, I'm still willing to take you for appointments because this transportation program, you have to be pretty mobile yourself, right? It's not an actual handicap service that has a lift for wheelchairs and stuff like that. We can put a wheelchair in the back of the van, but it's not for disabled people. You have to have some accessibility for yourself. So now I'm trying to deal with Terry and tell him, I can take you on trips, but you have to have some other mobility device besides just your cane. And bringing that up to him, obviously, he's getting frustrated with me. And I can't take that personally, as all of you guys know, right? It's because of all the things that have led up to this situation that now he's frustrated with. Then recently, last week, I had a quarter amputee client that I was dropping off in a different town around here. And he is very, very, very stubborn. He only uses 2 canes. So he was going back up his stairs. It was quite slippery and I was helping him, of course, a little bit, but he lost his traction on the wood and collapsed down to one knee. Then at that point, he didn't want me to help him at all. He was adamant on him getting back into the wheelchair himself and doing all these things to get into his residence himself. Now, that situation is a little bit more touchy for me as I have not dealt with that client very much in the past. So what I handled that one as is he is now in the hospital of medicine hat. Some things went downhill with him, so he went back to medicine hat. At the time, I let him know now in a sensitive way that I can't be taking him to appointments anymore because it's too much for me. As you guys know, being in the medical field, we're not technically supposed to be helping clients after they fall, right? That's an ambulance thing. You call it emergency services and they come deal with that sort of stuff. So pushing that on him was a little bit worse than my other gentleman because now he's very cranky and contacted my boss and said different things about how the program isn't helping him and different things like that. So in the discussion today, I just wanted to get kind of a brainstorm thing if you guys have had any similar situations or any situations with seniors' mental health in particular, or just accessibility stuff with declining physical health. If there's any kind of ideas that you guys want to bounce off each other and have a little round table about how to approach these different situations in a respectful manner.
I don't have any suggestions at this point, but I do feel the same sort of situation. I have a client that comes in that he has onset Alzheimer's. So he's actually accessing my FCS program. He's going to Hythe accessing their FCS program, asking us for the same information. And until we started connecting the two FCSSs, we were giving him repeat information because he didn't remember that he had just seen someone there the other day. And he's the one that told us that he has Alzheimer's in his family and he thinks he might be getting it. But every time we try and broach, like, oh yeah, remember you were already here, or we already gave you this information, like we already put in that application, he gets very angry too. So we're kind of in that same boat, trying to find a kind way to be like, maybe this is something we need to get looked at more. But his family, like he's also housing insecure, like he's living in his truck a lot of the times. His family has kind of cut him off because he is quite a handful. But again, like we're at a loss, like we can't take him to the hospital and physically have him like checked in or anything, but trying to get that piece, them to understand that we're here trying to help them, like we have your best interest in mind. But I think that accepting the fact that they need help and that they can no longer do a lot of the things they can do, like their mobility is now compromised, that's a really hard pill to swallow for a lot of older adults. But so sorry, I have no feedback to give, but more just I'm kind of in the same situation looking for ideas around that as well.
No, absolutely, Ryan. I also with my amputee type client, it's the same thing with his family as well, but they don't want to help him at all because they so he has animals, right? And we have like a housing program in the town that he's in, kind of. It's more like for low income seniors and stuff like that, but they don't accept pets. And he doesn't want to get rid of his cats. And as most of you guys know, people with different kinds of mental illnesses and stuff, their pets become like, right, their security blanket in a way. So he doesn't want to get rid of his pets to move into the cottages there. So his family is like, no, I'm not going to help you then, right? Because it's not my problem that you don't want to get rid of your pets and go live in a safe place. So I'm at a spot where I understand that he doesn't want to get rid of his pets and he wants to live in his own space and everything. But then he's not willing to even get home care nurses to go to his house because he's at that stage of stubbornness, right? It would be easier if it was able to just, yeah, call LPN and get home care to go visit him out there. But yeah, in this situation, I'm struggling on how to fix it. I know it's not our job to be fixing things, but yeah, on just how to give him advice. I've tried to let him know about different situational things that he could take advantage of in Medicine Hat because they have more services in general, right? Medical services, they have different housing services and stuff like that. But he's pretty adamant on being in the middle of nowhere and trying to take advantage of the services that can be provided to him in this little part of the province here.
I'll jump in. Sorry, this is my first time attending this group.
Oh, that's okay, Tatiana.
yeah,
Absolutely.
Thanks. My name is Tatiana. I'm a program manager for older adult services at the Jewish Family Services in Edmonton. Chris, we've recently had like kind of similar situation with a client that we refer to Drive Happiness. To receive subsidized transportation services through social prescribing project that GFS is one of the partners in Edmonton area. So unfortunately, this gentleman, probably due to some mental health issues, manifested very abusive behavior towards Drive Happiness staff. There was some sort of miscommunication or whatever, so he missed his ride, and it was not really possible to fix the situation, and he became quite abusive. So Drive Happiness declined working with him. But my case management team, we still were looking for some ways how we can support his transportation needs. So basically, he took a taxi ride a couple of times, and we were able to reimburse him for this transportation. Understand taxi is not always available in many areas across Alberta and Edmonton. It's definitely an option. And through social prescribing, we have a small fund that can cover transportation expenses for a limited period of time. But in general, what I hear from you and from what I observe, that most of the programs, whether it's transportation or we also run our own home care program or other like housing, right? They all very rigid programs. There is no flexibility almost anywhere. And with folks who have some mental health issues, diagnosed or undiagnosed, flexibility is the key in really trying to accommodate their unique circumstances. And it's really case by case. There is no like one approach that fits everyone. And the flexibility, it's a luxury that unfortunately many organizations can't really afford. But again, what I find when it is a possibility to be flexible, either with refunding the rides, and let the client choose their transportation and just be able to refund for the cost, or hire a home care provider who can come at their request, and not plan shifts ahead, when you need to notify the home care provider 2 days in advance if you cancel your appointment because we are not in the mood of seeing a worker, right? So with organizations that can provide that kind of flexibility, we see more success. So I guess the main questions for me, what can foster this flexibility in in the social service programs that can accommodate the clients with mental health issues.
Yeah, I find the flexibility piece is hard for a lot of different agencies, Tatiana, because like you said, everyone has their approved program set, right? And that's why I like the position that I'm in, because I can kind of take over all the things that aren't approved programs in town, right? And just do them personally and things like that. But you're absolutely right. Flexibility is a big thing. And I've noticed lately, even like you were saying with the dementia client, that you have to redo paperwork and stuff with her. Rihanna's not visible right now, but she was talking about a dementia client that goes to different FCSSs to do different paperwork or the same paperwork. I found lately that if I can do things that are a little bit off the book to just give people that mental health visa, I've been taking full advantage of that, right? Like my programs aren't as approved and mandated as the FCSS is, so I can kind of cut a little bit more corners just for the comfortability of my clients in that way. But you're absolutely right, Tatiana. It's very tough to be flexible if your agency doesn't allow certain things like that. Steph, can I repeat the question? Oh, yes, the question just in general, Steph, you're talking about the question just for the group?
Yeah, we had some new folks arrive after you put the general question in, and some folks connected to audio after. So maybe you could just repeat the general question just so that new folks can weigh in as well.
Absolutely. So we're discussing respectful ways to bring up different mental health, physical health, different issues that you're finding that your seniors in your different communities are experiencing. I'm also just going to put it in the chat right here as well. Sandy, good to see you, man. Do you want to introduce yourself quickly?
Sorry about that. I was involved in a conversation with an individual with mental health issues. So
excellent. What a coincidence.
What a coincidence. With the added side benefit of being a hoarder and in the middle of a foreclosure on his property. So I'm a licensed insolvency trustee. I've practiced in Alberta since the national energy policy in the 80s. So probably most everybody on this call doesn't go back to the 1980s. But I deal with a lot of seniors in my practice. I live in Lethbridge, Alberta. I also support a men's shed locally, which is sort of a men's support type system that we've gotten off the ground here in Lethbridge to try and deal with the scenario that I have, which is a gentleman who his former brother-in-law, because he's divorced, of course, got into trouble with his finances, and now we're struggling to, number one, deal with 12 years worth of tax returns that weren't filed, and he was an employee, self-employed, and things like that. So Chris, I get where you're coming from, and it is really hard. It's about spending time, though, is what I find. I'm semi-retired, so I have time on my hands a little bit, but it is about having the conversation and then trying to build the community supports around it. And yeah, there's a lot of programs that just doesn't work, right? Subsidized housing programs, especially with animals. People with cats and dogs, that's a real struggle for most housing programs to accept, because most of the facilities that are subsidized, they're not going to allow those pets. And so you're then trying to find spaces in community with some landlords that have some sympathy for that and empathy for those care animals, right? And yeah, that's where I came into the conversation, Chris. You were talking about the gentleman. It sounds like where are you situated?
I'm situated in Oyen, Alberta, actually, so I'm pretty close to Natasha, actually, about an hour away from Foster, but yeah, right on the southeastern corner of Alberta.
No Oyen well, it's a 3-hour drive from Lethbridge.
You got it. Absolutely, it is. Absolutely.
And yeah, it's in your scenario, it is really difficult to find the supports necessary. And how far out of town does he live?
Half an hour.
Yeah. You get up in that special area, old special area number 4, and transportation becomes a much bigger struggle, right? and the time to get to and from, and any really major supports for him are coming out of larger centers, right?
Oh, absolutely. And then if they aren't coming out of the larger centers, he's having to find ways to the larger centers.
Yeah.
And sometimes they're overnight trips. He could be there for days, right? Like he just got taken to Medicine Hat last week. And because of complications in the hospital and different health stuff that they keep finding, he's still there. You know, so it's hard to even plan for stuff like that. Like he could say, yeah, I'll be in the hospital for 2 hours, and it ends up being 24 or 36, right? Yeah, you just never know. But yeah, it's been a struggle to find, like you said, Sandy, it's tough with the landlords and stuff around here. Like there's not very many rentals that we actually have popping up around town to rent, because we have different, every time there's a new project in town, all the rentals get rented right away. So there's only so many places that people can stay in. Because of how secluded and everything it is, that's why he wants to be here. But again, then the services become the issue.
Yeah. I try and tie in, we have a very big core in Lethbridge of a volunteer network. And that's helpful when you have built your community around that, right? And it can be difficult. And then there's service clubs as well that sometimes you can rely upon for some assistance, if it's well understood. And then the church-based, we even tap into that a bit when I need to. Tatiana, you have at the Jewish Center, I know that you have some, in Edmonton, you have some reserve funds that you sometimes tie into. And the Catholic Church system has in a number of centers. I can't remember the exact name of it, but it's the last sort of ditch where I can usually go to find the individual clothes and whatnot, that when it's really down on his luck, right? But the unhoused is a real struggle, or maintaining housing once you've got it, right? My guy that I was just talking to, he's going to be unhoused. So we're busy trying to line up housing, which I know is 6 months out. I can't get him into housing for about 6 months. That doesn't help with the immediate need. How old is your gentleman?
Mid-70s.
Yeah.
And he's bounced around a lot as well, Sandy. Like he's only been here for a month, but he was in many different, Natasha knows this area about how many small towns and villages and stuff are around. So he's just basically been hopping around to the different towns and villages around here. Because like you said, he can't afford his rent. And when he can't afford his rent, he doesn't have anything around there. So he has to move to the next place. And like, it's been a struggle on how to bring it up to this gentleman. Like I said, I've been bringing it up to him respectfully, but then you get the anger thing that comes along with it, right? That he doesn't want these freedoms taken away from him. And who are you to tell me where I can and cannot live? You know? Yeah.
Sometimes I find that it helps to appeal to what are the positives of maybe some changes, but it is hard because you're dealing with pride and ego and wanting to be in control. And that goes down to, we had a project here in Lethbridge years ago where part of our Covenant Health system, we established 25 beds for our unhoused. And the struggle was they were happy to come in during the day, but they did not want to be there at night. It was uncomfortable to sleep there, right? And those types of mental perspectives of changing that, it's a time continuum. And it's really, I get where you're coming from, Chris. It's a real struggle, especially if it's a guy who first time he doesn't hear what he wants to hear, he moves on to another community.
Yeah, it is a little bit of a struggle in that way. Tamara, I just saw you pop up onto my gallery section. Do you have anything to contribute today, dear?
Hello, everybody. It's my first time joining as well. My name is Tamara, and I am the program coordinator for Rimbey FCSS here, obviously in Rimbey. Today, I'm just kind of a sponge. I'm just kind of listening in and just seeing. I don't have much to add, but I do love the conversation, and I love this topic a lot. Something that we definitely deal in Rimbey as well. we're having a presentation at the end of October that I'm inviting the community businesses, healthcare aides, and staff from Alzheimer's Association. So that's one thing that we do. We bring in presentations and presenters to bring up these topics. One of the topics will be how to redirect dementia patients or resident if they enter a business. So it kind of gives them that narrative and that redirection on how to approach the residents of Rimbey here. So that's something that we're doing, and it was actually asked to do from the businesses here in Rimbey. So it's something that we're going to be providing for them. So that's just something that we're doing to kind of help with the subject. So I think it's great. Yeah. So thank you for having me. I do appreciate this so much.
Oh, absolutely. Thanks for joining us today, Tamara. I
Mhm.
appreciate that as well. Definitely. Going back to a little bit of something that Rihanna touched on this morning with her dementia patient. So my grandma actually last year started failing stuff and had to be moved to a nursing home in Nova Scotia. They took her back east to be with the rest of the family and whatever the case may be. But it just makes me think about how we were bringing stuff up to her, right? Being a member of the family. And I think that actually is going to help me out in this situation because it's about being assertive respectively still, right? Like they don't want to be led around the bush and beat around the bush with things. I just think the main thing is just going to be telling him what the next steps are and just preparing him for that, I think is the more acceptable solution to the problem instead of trying to give him different ideas about this, that, the other thing, and let him make those kinds of decisions when he's not really in that mental health space. I think it's going to be a little bit easier for me to just be assertive and just let him know, okay, these are the next steps that are happening. You can like it or not like it, but this is what's going to happen. I'm just trying to prepare you for the future steps that we're going to be taking with him.
I don't know either, just to jump in, that we're kind of having this with my mother-in-law, and of course it's a different relationship. I'm a lot more closer, but she's been falling a lot, and we said, like, it's time, you probably might need to go to a wheelchair, and she's like, I'm not ready for that. So we kind of played it like, okay, but if you fall and break your hip, now what? And now you're laid up even longer than you are now. So sometimes I don't know if this would work, like giving the harsh realities of like, but if you do fall and hurt yourself, now what? And now you're even more incapacitated than you were before. And your healing process is not going to be near as quick as if you were younger in that. So I don't know if like giving that harsh reality would work. And again, like I said, like with my mother-in-law, it's easier because I can be more direct in that with her. But sometimes maybe just like reminding them of the realities of if you do fall at this point, like who is going to care for your pets then? Who's going to walk them for you? Who's going to, like, there's so much more to think about if you do fall. So I don't know if that would be helpful at all for that person, like, you know them better, how they might react, but that's
Absolutely.
something we kind of went through, that kind of tough love almost.
And I think with just the demographic of clients that I deal with around here, and I think that will work pretty well just because they're not used to being coddled, right? So if I just tell them like, dude, you're gonna fall again, you're gonna possibly be incapacitated and then not be able to walk at all. Like forget about being an amputee, you're not gonna be able to walk. And I think especially some people in my community that I'm in right now will be able to relate to that a little bit better than the new age coddling thing, I think. So yeah, that's a really, really good suggestion. Actually, I really appreciate that.
I think at the same time, Chris, too, like your clients just need to know that you want to support them, you want to help them, right? Like I want to be able to pick you up and take you wherever you need to go, but if you're not going to use your walker, then I can't, right? So, as opposed to just like, I'm not coming to get you anymore, right? Like, but I agree with Rihanna though. I think there needs to be some of that harsh reality too, right? So you fall, you're gonna sit here until I call an EMT to come and help you, or you can just use your proper equipment and we don't fall in the first place and we're not wasting time doing some of those things, right? So, but I think they just need, I think part of it is they still need to know that they matter too. And I think like Sandy said, it is all ego and pride and all of that, especially with the men, I think too, right? When you start taking their licenses away and things like that, they feel
Yeah.
like they don't have a lot of self-worth anymore and don't have a place, right? So
For sure. And then that just wears more on their mental health because, like we were saying earlier, these men in my community at least are the ones that have been taking care of the family and have been doing everything for everyone else. So you're right. Once they start losing those freedoms, it just kind of a
well,
slippery
those
slope.
who may have dementia or Alzheimer's too, they don't realize they're being jerks either, right? Like it's just they're not controlling it. They don't even know it half the time. And so you get frustrated and pissed off, but they don't realize what they're doing sometimes either, right? So and they're frustrated too, because either like somebody said, like they can't remember that they came here already, or those sorts of things. So we have to try to understand kind of their own situation too. And, it's frustrating for us that they're coming to us 3 times for the same thing, but think of how frustrating it is for them, which is why they're getting angry because they're like, well, I don't remember ever being here, so it's just a cycle, right, with them. So,
Yeah, definitely. Definitely. I just want to bring up something that Tatiana left in the chat. Actually, she said some of our staff had a motivational interviewing training where they could where they find it helpful working with the clients who may be reluctant to accept help. I don't have many details, but I've heard positive feedback. I find TIPA's show recommends on how to work with dementia clients are very helpful. Motivational interviewing is awesome, actually. I went to school for different addictions courses and things like that, and I'm an addictions counselor. But yeah, motivational interviewing is it works wonders. It sounds super cliche and everything, but just being able to point out the strengths that different people have and letting them know how to use their different strengths, it's a powerful thing for especially some of the seniors that we have in this community for sure. Because even though they may have gotten their driver's license taken away or things, they're not useless still, right? As we all know, there's still other things that they can be contributing to the community and whatnot. It's just about bringing those things to their attention, I think. So yeah, thanks for that, Tatiana. I really agree with the motivational interviewing.
Well,
I
Chris,
also
think,
wanted to, oh, sorry, Sandy.
go ahead, Tatiana.
Yeah, just a quick, to add something quickly to that we, working in at the GFS in a couple of projects for older adults, we've noticed that we have more and more clients with mental health, especially among older adults. And although our staff does get some trainings around mental health, but still it's not our focus, it's not our necessarily the expertise of the case management. But the fact that we get more and more clients like that sort of prompted us to start a discussion with within one of the projects, which is social prescribing, to have a role of mental health coordinator that would sort of provide support, mental health support to both the clients and the case management team. So when the case management team lacks the understanding how to engage in certain cases and how to maybe talk, exactly answering the question, the main question of this discussion, what would be the right way to bring up something respectfully to the client who suffers from mental health issues, they would have access to a mental health professional who can advise them on strategies. So we really hope to get funding for having a full-time professional who would be, again, like supporting the clients who are deemed stable and willing to participate in counseling, but also to support the team across a few agencies, consulting them about cases when mental health is a component. So fingers crossed, we hope really to get it at some point. Again, because we've noticed as many other agencies exactly the same trend that we have more and more clients with mental health issues, and we don't necessarily need to have that kind of expertise, right? We don't want to duplicate someone else's services, but at the same time, there is such a lack of mental health support services in Edmonton area. We can't consult, we can't refer those clients. So really, it's frustrating to operate in the environment when you have to rely only on yourself. Yeah.
I understand that for sure, Tatiana. Yeah, definitely. And when it comes to support for, I guess, support workers as opposed to our senior clients, I'm a little bit new to the senior serving sector. I've only been in this type industry for about 2 years. Tamara, I have a quick question for you. Do you know if the Alzheimer's Society provides some type of thing like that, as well as education for caregivers, as well as education for the elderly client? Because I know we've had the Alzheimer's Society here a couple times in town as well, but they've only been speaking with our clients. They never do any kind of program or educational stuff for the actual workers.
Oh, yeah, no, they absolutely do presentations and workshops for staff, healthcare aides. I've had them in a couple of times to do presentations, and they're wonderful. You pick a topic and they do slideshows. They bring in information sheets, pamphlets, anything that you kind of request. They're all over it. So I can send information on that to you guys if you want, and the contact number if you want. If not, then that's okay too. But yeah, they definitely do presentations and workshops for workers as well.
I'm just going to put my email actually in the chat if you want to send that
Perfect.
over to me. That'd be
Yeah,
awesome.
I definitely can.
Yeah, so I just popped that in there.
Tamara, I had to just step
Oh,
away
good.
for a second. Which agency is this?
This is the Alzheimer's Society.
Oh, the Alzheimer's, yeah.
Yeah, they're great. Jackie and Donna, I talked to them numerous times, and I've had them in a couple of times in Rimby here to do presentations. And the next one that we're doing, again, like I said, is going to be for community businesses as well. And it will touch on this as well, and how to have that narrative to talk to dementia clients and residents in town here.
Sandy, do you find, oh, sorry, Tamara, keep going.
I think I was just going to add, our biggest problem in Rimby here is isolation. I think that's the conversation that we're needing to have people here in Rimby. Our seniors here do not get engaged with programs that we do have. And it's like, I really feel like I need to go to door and knock on their door and be like, we have this program for you. Would you like to come? Would you like to come out with me to come see what it's like? So I think that's an issue and a gap that we're really trying to focus on. We also have a rural mental health liaison kind of a person here right now who's kind of going to be doing that, kind of noticing who, or if we see somebody who's not been leaving the house or leaving the room in the manor, they can go knock on the door. They will have that training behind them to kind of have that dialect with them to try to just, even if it's just coming out of the door, walking down the hallway, seeing what's there, or going to the seniors drop-in for one time for floor clearing or whatever, right? It's just as simple as that. So that's another thing that we're bringing into Rimby as well.
I'm finding the same thing here for sure, Tamara. It's hard to get them to actually attend the programs and different sorts of things like that. Like the seniors in Oyen right now, they always attend the floor curling and they always attend their chair yoga. But that's things that have been going in town for a long time, right? It's been I get it, and it seems like you almost do have to just go to the lodge and just go down every door, right? Because yeah, trying to get implement new programs, especially seniors-based programs, this town, it's tough to get the turnout sometimes, because I don't know if it's that they're nervous about doing something new with other new people, or I'm not sure exactly what it is, but it's been a struggle for us a little bit with that as well.
Well, I think as we get more aging in place scenarios occurring, because lodges aren't available, it becomes even a bigger struggle. And that's where support things like a men's shed or other type of gathering can be helpful. But yeah, Tamara, I get the issue. We just got our men's shed up and running here in Lethbridge. Population 100,000. We're getting 30 people out. We think we're winning. But that, as a percentage of population, it's not. But it's getting 30 men together who now feel they have some supports because they're either widows or they're divorced or bachelors. And to stereotype men, they're not really very good at dealing with their emotions to begin with. And especially when they've had that scenario of being the bread earner for a family and losing their value, as you mentioned, Chris. It's really difficult to let them see that value again that they bring. And that's one thing that we found with our men's shed was that we're seeing that turn for some of them, and it's improving their mental health. But it is a struggle to do those types of programming and get that initial core group that believes in the system to try and move it forward, right?
We met with
Especially
our,
with zero budgets.
yeah. We met with our seniors in our lodge a few weeks ago when we were planning our New Horizons for Seniors grant. And the men that were in there were like, the women came with a list of stuff, right? Like, we want to do this, we want to craft, we want to do this and that. And we said, okay, guys, what do you want to do? And they're like, we don't want you to plan activities for us. We just want to hang out. Like, we just want men to hang out with. So I thought that was kind of interesting because we did start a seniors coffee group with our last grant. And so they're like, we just want you to get more people to come see us. More people show up just to talk. Most of them are used to be farmers. They talk about the weather or farming, whatever. So I thought it was kind of interesting. They're like, yeah, we don't need you to do all this stuff for us. Just bring us people like other men, because there's so few of them in the lodge as it is, right? So I thought it was just kind of interesting, the different perspectives from the females to the males and what they wanted to do. But they're just like, yeah, don't overschedule us. Just give us time to hang out with ourselves and do our thing. So it was quite interesting, actually.
Steph, you've got your hand up.
Yeah, I was gonna say along that with just like hanging out and having a cup of coffee and what Sandy said, there's also, just so folks know, there's a whole video in the men's shed group on like how to start a men's shed. If anybody in your community just wants to have that like hangout and coffee meetup, just hanging out with the guys. And Sandy, correct me if I'm wrong, but I think it's like you can apply up to $1,000 to get the group running to pay for like
Yeah, Men's
the
Shed Canada
snacks.
now has $1,000 that they are allowing for funding. If
Yeah.
you go to Men's Shed Canada, you will find it. And it is, Natasha, where are you located?
In Consort.
On Consort, okay. Not too far away from Chris,
Just
Yeah.
up the street.
just
Yeah.
up the street, about 3/4 of an hour, I think it is, isn't it?
Yeah, yeah,
Yeah.
about that.
Yeah.
Yeah.
There you go, Chris. You need to collab on a men's shed with Natasha.
Yeah,
But
that wouldn't be a terrible idea.
you bring it up, and that's what we find is that the men that we're getting out, it's first to get them together. Now they're getting some social interaction. Then we introduce how they can be of value. Like we've got our men building neighborhood drop library stands, right?
Oh, yeah.
Take a book, give a book type scenario. That one of the other organizations said, hey, we'd like to have these in our community. Would you come and build them if we can find the materials? And all of a sudden, we've got a couple of men saying, yeah, I'll do that with. And then they'll get a couple of the other men together and they start to work on it. And they get the whole idea of a men's shed is shoulder to shoulder, working on something, or at least not having too much programming put in front of them. And you have to be really careful with it, what you do add to it. But it's providing a safe space where the guys get together. And it's funny because behind a lot of the sheds that do exist in Canada is actually females helping with it, because the men don't want to do it themselves, but the females in their lives are seeing the value of having him not sit in front of the TV or hang out in the house, because he's much more introverted in general than usually the female of the household when there is the married individual or the one that's living common law. Our men's shed here in Lethbridge that we just got up and running, we're not even a society yet. We're just found a young individual who was prepared to sort of manage it and he's about in his mid 45s. He has an associated business that is maybe benefiting a bit from it, but in reality, what it is doing, it's just providing that safe space. And the coffee pot's somewhat cheaper than if you did that in a restaurant, right? And we set dates, Tuesdays and Fridays, 9:30 to 11 o'clock. That's the other key, is having a set time frame for these types of interactions, right? We found that it's helpful. Yeah, we have people that have early onset dementia, et cetera, and you're not going to get away from those mental health issues. It's just, how do we address them? And I do feel for you, Chris and Natasha, where you're at, because your access to resources and the moccasin telegraph that occurs in smaller towns. I myself come from a place called Westlock. It's north of Edmonton. I live in Lethbridge now, but I remember the struggles I had with my mother, who was in a lodge facility, and I needed to invoke a power of attorney under the old rules. And I had to eventually, it was sad, but her dementia got so bad that to get her out of the lodge, we had to get a court order where the lodge had to apply for it. And then she deteriorated pretty quickly. And this was about 12 years ago now. But the moccasin telegraph was that the local doctors were not prepared to sign off because they were afraid of what that meant for them.
Yeah.
And of course, you didn't have a gerontologist there who could say, hey, we're seeing all these markers, right? And that is one of the other problems for Consort and smaller communities, is that you don't necessarily have the skill set present in the medical professions within your towns.
Concert doesn't even actually have a doctor right now. We're running on a nurse practitioner.
Yeah.
No way, hey, Tasha?
Yeah.
Oh.
Yeah.
I wanted to say, Sandy, with the men's shed, I think one of the big things about men's shed is you're not actually saying it's for mental health for men. And I know a lot of guys around here, if they knew that it was helping their mental health, they just wouldn't go for that reason, right?
Yeah.
But yeah, I find that it's a low-key way to introduce mental health to male seniors in particular, for sure, because they don't think about it that way. They think about it as going to hang out with the guys and have some coffee and build a chair or fix a lawn ornament or something, right?
Or,
Like I want to actually, now that everything has settled down and I might be able to do something with men's sheds now, we have a gentleman in town that builds birdhouses, actually. They're like super extravagant. So like that's another thing that could be added into the sheds as well.
yeah, the shed system can be just whatever you want to create. I leaned in heavily to punch Jackson, I think Jackson, yeah. When we were initially dealing with it, and he was a great resource. And of course, you said New Horizons, and where I first got involved with men's shed was Cold Lake has a men's shed, and they're running it through New Horizons. Was their initial funding. But it's finding that value and finding a local champion is a struggle usually.
Yeah.
But to have that, and yeah, you're right, Chris, you can't approach it as you're coming out to a place to get your head on straight. It's more about come out, have a coffee, meet some guys, and hang out. And then it's building value from that, because we have a Facebook page for Lethbridge Coaldale Med Shed, and one guy brought out some woodworking pieces, and he's a fairly engaged individual already, but he was able to engage a couple of other people who had that interest in the past. And sometimes when we deal with someone with dementia or there's Alzheimer's issues, it's taking them back to something that's familiar, right? And letting that come forward again, right? And it's interesting when you see that spark in the eye that was the dead eye syndrome, and then you see a spark, right? Makes it all worthwhile.
Definitely. Definitely. I find we see the spark most often with just anytime there's children around extended care or the lodge. Like it's not just the grandparents that the children are going to see that get enjoyment from that. You can see the entire building light up when there's little kids in there.
And it can be other things like animals too, like
Oh yeah.
I'm involved with Lethbridge Therapeutic Riding Association as well. And during COVID, we actually got a grant from our local community foundation to take horses out to seniors facilities. And it was impressive the amount of connection that the senior had just seeing the horse, because they're all of an age that they actually kind of remember that part of their lifestyle.
Yeah.
And it can be really, and it can be a service dog or anything coming into that sort of center, and it can create, again, it's creating community around that animal being present, right?
Yeah, definitely. It's so interesting the different things that contribute to, I guess, mental wellness for seniors. It's very interesting to me, to be honest with you. Does anyone have anything else to add to our little conversation here today before I let you get back to work? No? I appreciate everyone coming. I know it kind of took a little bit of a turn from speaking to mental health respectively to other things, but they all kind of tied in together, I think, anyway. I did set up a new different meeting for October. I do not have the topic yet. If you guys have anything that you want to speak about or have any ideas, feel free to email me. I can put my email in the chat here again just before we go. But if not, thanks everyone again for coming, and hopefully see you guys next month.
I'm gonna toss the survey in the chat too. If you have thoughts or feedback for future sessions, we have it there as well. You can either
Thank
email
you.
us or you can put it on that.
Thank you for that, Steph. That will be a little bit easier probably. But yeah, either one, reach out to Steph or I, whoever you feel more comfortable speaking with. So thanks very much, guys. I'll see you guys all next month. Take care. Have a good rest of the day and good weekend. Happy long weekend, Tasha.